Today's quality measure is glycemic status assessment for patients with diabetes. For HEDIS, the measure title was previously known as hemoglobin A1C control for patients with diabetes. It has been revised to glycemic status assessment for patients with diabetes. Payers include commercial and Medicaid. The 2024 measurement period is January 1st, 2024 to December 31st, 2024. The denominator includes members 18 to 75 years of age with a diagnosis of diabetes type 1 and 2. Patients are identified as diabetic through claim or encounter data and/or pharmacy data. There has been an added laboratory claim exclusion to value sets for which laboratory claims should not be used to determine a diabetes diagnosis. The numerator includes members 18 to 75 years of age with a diagnosis of diabetes whose most recent glycemic status was performed during the measurement year. Poor control is considered greater than 9%. Control is either less than 9% or less than 8%. Glycemic status assessments vary across payer contracts. The numerator has been revised to clarify that CPT Category 2 code modifiers should not be used. This measure may exclude patients who had hospice or palliative care services or died during the measurement year. All of the following are required for documentation: a note in the medical record indicating the date when the HbA1c test was performed and the result expressed as a specific numeric value. If there are multiple glycemic status assessments on the same date of service, use the lowest result. GMI results can be patient-collected and reported. There's no requirement that there be evidence the GMI was collected by a PCP or specialist. Here is a sample of a lab report. It includes all 4 elements needed to close the gap in care: HbA1c as the test name, 6.3 for the results, type 2 diabetes diagnosis, and the collection date within the measurement period. Common insufficiencies: result unknown or missing, date of service is missing, outside of percentage threshold, not within measurement period, not completed, or there is no diabetes diagnosis. Failing to document the most recent assessment. For example, the A1C test completed in June is compliant, but the most recent test in December is non-compliant as it is above 8% control. Acceptable dates for HEDIS reporting include collection date, reported date, and claim date. Not acceptable are order date and documented date. Here is a sample of an office visit note, but is the documentation sufficient? As we know, we need 4 key elements of date, type, result, and diagnosis. Circled in blue, we have a date, a diagnosis, and the mention of an A1C, though this document would not be sufficient. The main reason is because the date is a documented date of the office visit and not when the A1C was collected or reported. Secondly, the note for A1C may be considered too vague. Though 6.3 is a numeric value, it does not include a reference percentage range, nor is it within their lab section of the note. Here is another sample of an office visit note. Is this documentation sufficient? The same information is circled in blue of a date, diagnosis, and A1C with a result. The A1C result would be compliant, but this documentation is still insufficient. There is no date of service for when the lab was collected or reported. It is not clear if it was taken at the office the same day as this office visit of 12/9/2024. Relevant codes that a primary care provider is the direct biller are listed below. Submission of these codes will close the quality gap through claims with the payer, especially when medical record review is unavailable. Let's review best practices. Make follow-up phone calls for patients who have not completed their assessment. Educate patients on risks of uncontrolled glucose levels. Our care coordination team can provide additional individualized support. Upload reports with the most recent assessments into your EMR and label clearly for easy identification. Ensure workflows are in place to notify and remind providers of when a patient's next assessment is due. Care coordination team consists of registered nurses, social workers, navigators, and health coaches. They can help answer questions, assist with patient self-care, improve medication adherence, work with your practice's healthcare team, and assist with scheduling specialty appointments. Continue working with your clinical performance consultant and use ACN's additional resources. The Diabetes Toolkit can be found on Arizona Care Network's website under the Patient Resources tab. All of the updated 2024 tip sheets can be found on Arizona Care Network's website. This concludes the Glycemic Status Assessment for Patients with Diabetes training course. Thank you for listening.